All right, you get Marshall County Watch. You got Lynn Sumner along with the dude. And we have our special guest, Dr. Kenneth Williams. We're going to be talking about the health care in Marshall County and what's going on with the Marshall County Hospital. And before we get to that, we got to do our disclaimer because, Go ahead, Lynn.
Okay, the views and opinion of Marshall County Watch is not necessarily that of WKRA 92.7 The Change. We value your input, but just take into account that we all have free speech.
Then also, what we need to do, we were invited to the opening of the art.
Oh, wow. What a fantastic opportunity to be there and enjoy it. And Billy Autry has outdone himself this time. Thoroughly enjoyed it. The place is beautiful, it's big. It has 2 honeymoon suites upstairs.
Yeah, that was really nice.
If you have an event, please plan to have it there. I plan to have my birthday party. Hopefully, we will see big things in Hollis Springs due to the art.
You know, I'm the dude on WKRA, but hey, Mr. Billy Autry, Mr. Billy Ray Autry, he's the dude in Hollis Springs.
He is the dude.
Yeah, he's making it happen. Now we're going to get to Dr. Williams. If you want to be a part of the conversation, call 662-622-2192. And then you can get in and if you have any questions. And how you doing this morning? Well, this afternoon, Dr. Williams.
It is afternoon.
Yeah.
I'm doing just fine. Great to be here. Glad to be here.
And are you originally from Holly Springs?
No, I'm from Mississippi, but I grew up on the Gulf Coast, a little town called Moss Point, Mississippi.
Yeah, know where
I haven't heard of that.
is. Yeah, I know where it is.
So how long you been in Holly Springs?
Oh, since in the late 80s.
Oh, okay.
Yeah, I've been here for a good little while.
Oh, yeah, that's a long time. How long you been part of the hospital?
We took over the hospital. Well, now that's an interesting question. My clinic actually was in the hospital before I owned it.
Oh, okay.
And I'm going back in time.
We coming through good.
You can come a little bit closer.
Okay.
Yeah, I was just going to say.
Do I need another mic?
Oh, you can come closer to that one.
Oh, come close. Well, I got one right here that may do it. Okay. Go ahead, Dr. Lee.
Yeah. So the hospital back when I first got here was almost closed back then. And actually, the people that were running the hospital at the time, I moved here.
Go ahead. We lost some power there.
I was originally in Bahia Clinic, and they needed a doctor in the hospital. When I first came here, there was actually one patient in the hospital.
Oh, okay.
So this is not the first time the hospitals had issues.
Right.
But long story short, we came in and we made a difference back then, seeing patients, and eventually worked out something with the people that own the hospital, and we put our office on the 3rd floor. So we took over the whole 3rd floor of the hospital.
All right.
Before I actually was in this office. And you mentioned Billy. My office was right next door to this building.
All right.
To the radio station.
All right.
So I think Ralph Doxey was the person that had gotten it after Billy. But long story short, the radio station that is.
Yes.
So we've been happy to be. When we converted to a rural emergency hospital, it was a new federal guidelines through Medicare. Mm-hmm. It was built to save the emergency room for the community. We were the 2nd hospital in the country to get the designation. The CMS or Medicare gave us $3 million a year to keep the emergency room open. Okay, now that's about what it takes to keep it open. Unfortunately,
but that's really not a lot of money for an emergency room.
Oh no. And I'm glad you said that. People here do this money, but 24 hours a day, that's 3 shifts. You got a doctor, you got radiology, you got x-ray, you got
support staff.
You got support staff.
No one's going to work for free.
Absolutely. Oh, you got that right. So long story short, when we made that the emergency room can be open. The rural emergency hospital, we got the designation. We thought that was going to be the win. This, again, was necessitated only because we weren't getting patients. from the ambulance. Now I can't drive myself away from that
Yes.
because it's not that it's a hospital in Olive Branch that caused our problem. It's not that it's a hospital in Oxford that caused our problem. Our problem was caused by that. Okay. Now we also gave the county officials in January, we gave them a list of the number of emergency room visits from when we took over the hospital to up to that year, every year. And it's clear that the numbers started decreasing when they signed a contract with a particular ambulance company. So, I mean, it's point blank and clear what has happened. Alliance Healthcare, despite everything else, the service area is Holly Springs, going towards Ashland. It's our service area.
Yes.
We understand that North Marshall County is going to go to Methodist in Olive Branch.
They're going to go to the
closest one.
Yeah.
But they are doing a disservice and ignoring the needs of the people here.
Yes.
That's what's being overlooked. The people here are not getting the service that they deserve to the emergency services that they need. Okay.
Now, what would you think would be the best to try to rehab this hospital or to just build a brand new hospital? And then what would be the time frame for that?
In that same meeting, I gave them a proposal on getting the emergency room open. And also I told them that building a new hospital is the thing to do.
Okay.
And I also, there are 4 different types of hospital we can build. There's a micro hospital. There's a small community hospital. We have the CON to build a hospital similar to that, but that's not needed these days. Okay.
Yes.
We want a limited full service hospital, but we don't need a full service hospital like when that one was built.
Yes.
Okay. We're not going to, we can do small surgical stuff, but we don't want to be doing any big cardiac surgery.
Right, I understand.
Like that.
Yes.
So a limited service hospital is what's needed. And quite frankly, what people don't really understand is that's 96 to 99% of healthcare.
Yes, it is.
That's it. I mean, and the stuff that you can't take care of, you send them to where they need to be.
At least you can stabilize them until they can get to the proper facility for,
But we reported on several people, that's died trying to go somewhere else when they could have came right here.
Right. Well, see, the reason that the excuse that the ambulance company used, and we tried to meet with them, and I'm not trying to, I'm not a negative person, but we tried to work out something with them. We've told the county, said, look, these guys are not working with us. They don't have to. Right. They have no incentive to work. Yeah, they have no incentive to work with us. So you signed the contract. We weren't even involved in the conversation,
But I mean, these guys get paid regardless of they do anything or not. But then once they come pick you up, you would think the money they're getting paid to ride should be free. But you or your insurance company still has to pay. And they're getting paid $100,000 a month just to be around.
Let's clarify that. $162,000
just to be around.
$100, yes.
And then
so that's over $1 million a year. That
to basically
put 2 more with it
just to be around
service.
Yeah, that's
and it's not manned. They're not there.
That's about
100%.
That's about $2 million.
Yeah.
That's about $2 million.
Yeah.
And they can also bill for their services if they take you somewhere else. In the ambulance, I want y'all to also understand this. An ambulance is paid
it's not allowing me to.
on 2 different things. They are paid per transport, but they also paid per mile.
So it's feasible for them to take you to Olive Branch, which is 20 miles, instead of bringing you around the corner for 5 miles.
They are paid per mile.
And it's a business. It's a private business.
That's
so, and their employees might be getting a little bonus for collecting more revenue. We don't know. Because it's a private business, they can do whatever they want.
Absolutely. I'm not saying that that's what's going on, but it's unless you know, but you can think of all kind of reasons. But the reason to not bring people to our emergency room, let's debunk the myth. There was no reason. An emergency room at Alliance Hospital, emergency room at Methodist, emergency room at Baptist is an emergency room. You get
Yes.
there to stabilize.
Yes.
That doesn't mean that patient needs to be admitted to that particular hospital. You stabilize them, and then if they need to be admitted, you can we can admit you here, Ms. Jones, or we can send you somewhere. You talk to their physician, and that's how we've operated for years. So their excuse was they don't have the capabilities to have. Oh, that's just mess.
And to be honest, that's not their call. If there's a medical doctor there, that's his call, whether they're equipped properly or not.
Yes, we had a physician in there, and we always had a physician in-house 24 hours a day, 7 days a week.
There's no excuse.
Now, on the if they decide, okay, we're going to build this hospital, I mean, which one of the three you think would be the best, and how long you think the turnaround would be on that?
Well, the emergency room, I mean, between 0 and 6 months, we could get the emergency room, even if we got this emergency room back open. You got me?
Just a service.
Yeah, just a service. And I actually have printed a transition plan. It's out in my car that I was going to try to give to the Board of Supervisors. But I mean, quite honestly, the last time I went to the Board of Supervisors meeting in January of 25, guys, I'm disheartened to say that I never got a word back.
We got a listener. He wants to. Can you speak to the cost of the ambulance service versus rehabbing this hospital?
Well, now that's a long question.
All right.
We'd have to do a feasibility study of rehabbing this hospital. Now, years ago, I did a feasibility study. Now, this has been several years ago, and it may have changed.
Yes.
In order to rehab this hospital, it was going to take $15 million.
Right.
In order to build a new one, it was going to take 22. Okay. Now, that's been over 15 years ago.
So that's drastically changed. And then there's more damage happening to this one. Then the supplies has went up astronomically since then.
And since that time, we said, well, it's time to build a new one. And quite frankly, we have tried to do it, but healthcare since 2006 has changed.
Yes.
The profit margin is gone. When the insurance companies got into the healthcare business in 2006, that's what changed the narrative.
Yeah.
So this is not new. The last 20 years, it's been hard on rural hospitals. All you got to do is look it up, rural hospital closing. In the last 15, 20 years, you will be shocked to see how many have closed. It's amazing that we still are open. Now, people walk around and say we're closed. No,
you were closed.
Hospital is not closed. We still have.
I need to get in the shot.
We still have an active license to operate. We still have to do a CON every 6 months to build a new hospital, which we have active. The new hospital we propose and we build it out where my clinic is, which was built in 2008. So there's always been a plan, but at this point, the plan, you have to have a partner. Yeah. And our partner, who should be our partner, is the Marshall County. And I guess they just really don't want to be a partner with what we're doing.
All right, we got to take a break here, and we'll be right back with Dr. Williams. And again, if you're a listener, viewer, or you can call in, or you can hit us up on Facebook for any questions. All right, thank you. We'll be right back.
My wife would text me, "Don't you get mad on the radio?" I said, "I'm not mad."
How do I get the script on?
See, I'm a big guy. That's why I said that. That's why I kind of did. I ain't no little guy.
It said lower hand, but
I can lean like this if you want.
Oh, here's the script. No wonder I ain't got the script up. I ain't on the script. I'm hitting them by raising my hand. There it is.
No, we're live, right?
No.
What you say? We're on Facebook.
We are?
Yeah.
Oh, we good then.
Facebook Live.
We Facebook, YouTube. Okay. Yeah, we what was it? We're on Instagram. We look, this is a podcast. We're doing it all.
Funeral homes, honoring life, designing
your the script is up, Corey.
Affordable packages and veteran services. Funeral Homes, here to serve you.
He said
Tune in
again,
to Marshall County Watch with host Vernon Briggs and co-host Len Sumler, airing on 92.7 WKRA, Saturdays at 12 noon. Bringing you community news you can use. Call in with your questions,
it went dead
concerns, or sponsorship
for a minute,
opportunities at
but it's on Facebook. What part they did show for the life,
622-192.
and then it's on Instagram. You can go to YouTube. You can go to YouTube, Marshall County Watch. We put it back on. All right, we are back, and Dr. Williams, I talked to the board once when we were there, when we were trying to get everything done. And what happened, they said, well, we talked to Dr. Williams, and we wanted to get talk to him about having an ambulance service. And what they told me at the time was, well, he was kind of unsure if he could provide an ambulance service or not, and they didn't want to get rid of the one they had and not know 100% that you were going to be able to provide one.
Before you answer that, can we take this call, please?
Okay, let's take the call.
All right, caller.
Good afternoon. This is Delbert LaSure in Holly Springs, Mississippi. Let me say this. I really appreciate you bringing Dr. Williams on today to speak about this very important issue to all of us here in Marshall County. We definitely need some emergency services here. We've had people to die from illnesses like strokes, different heart attacks, and different things just because there's not emergency care accessibility here. And so this is a very important topic that's near and dear to a lot of folks. So thank you so much for doing this. But I've looked into this a lot, and what I've found is that, and I know that some folks may not want to hear this, but race has a lot to do with why they don't want to be a partner with Dr. Williams. I mean, just the color of his skin, and because every time that I've talked with, say, a supervisor like Nia Bennett, or it's the county administrator like Tim Powell, they always bring up. They always try to count his pockets. What is he making? And different things like that, instead of taking care of that county-owned property out there. And so, and I'll submit to anybody that if Dr. Williams was a white man, we wouldn't be concerned about what he may or may not be making or what he have made over the years. We'll be more concerned about making sure that our elderly and disabled folks here have emergency services. So I'm not really sure how Dr. Williams or anyone else feel about that, but I've looked into this extensively, especially over the last few months, and I've spoken with different folks as well, and it's just all boils down to the color of the man's skin and with him having that certificate of need. And I just want to tell Dr. Williams that we support you 100% out here in this community on getting some emergency services, but the public needs to be aware that these individuals are blocking emergency service simply because they're trying to count this man's pocket because he's a black doctor with a certificate of need. If he was a white doctor, that wouldn't even be relevant to those folks. And this is the only county building that's owned by the Marshall County taxpayers that's leaking. And if you ride out by there, you will see that that they haven't even picked up the trees from the storm. That's the only county property. That's an 18-acre, 200,000 square foot building out there, and that's county-owned property. That lease with Dr. Williams expired in March of 2018. So I know that I'm not the only person who knows that, and who knows that the owner of the property should be taking care of the maintenance and repairs to it. But I know that Tim Powell should know that. We pay his salary. And I know that Nia Bennett know that because I gave him the documents to show that. So these folks know what they're doing, but we have got to make other folks, especially the voters of Marshall County, aware of who's actually stopping this hospital, the emergency care services, from coming into Marshall County. I want to also thank Red, Supervisor Glover, and Supervisor Zien for standing steadfast in actually trying to make sure that our people in Marshall County have some emergency services. And so, and again, I've looked at this. If someone can show me anything other than what I just stated, that this is based solely on race, if someone can show me that, I would really appreciate it, because from my point of view, what I've observed, and from conversations with Nia Bennett and with Tim Powell, they're trying to count the man's pocket because he's a black doctor with a certificate of need, and that's shameful. And again, thank you for bringing this gentleman on.
All right, thank you, Carla.
We appreciate all opinions. And observations, me personally, I don't have that information, and I really hope and pray that that's not the case, because regardless, when one bleed, we all bleed. We all bleed the same way. When you do an autopsy, you open them up, we all got the same organs and everything.
So we're interchangeable.
We're interchangeable. Yeah, we are interchangeable, actually. And thank you, Mr. LaSure. But we're going to get back to the question that you asked Dr. William about the ambulance service.
Yeah, because that's what I was told, that that was one of the sticklers that they had, that it was almost like you wasn't sure that you could provide it. He said, well, I think I can, maybe I should be. And they said they needed concrete that, hey, if we get rid of these guys, that you would definitely have another ambulance service.
Yeah, okay. And I'm gonna go there, and I don't want to ignore what Mr. LaSure said. It is what it is. You know, we realize that being from Mississippi, being a black male, you don't want to think that exists. But we still live in a time.
Yes, it's
we
obvious.
still do, and especially in my field, what you just said, someone who doesn't look at people's color, and I'm not supposed to, because I was brought here to take care of people, whether they white, black, Hispanic, and that's what we've done at our practice for years. My first patient was a white lady, and my business started growing because of an older white female who passed the word, "This doctor's okay."
Right.
I'm just being honest with you.
Like you said, it is what it is.
It is what it is. So when people come through our doors at our clinic, we got providers, we got mixed race providers in my office. Guess what? Yes, I'm a black man, and I'm a proud black man.
Yes.
But I'm also proud that because we want to do a good job, and we want to take care of people the best, we want to show everyone what we all about.
Yes.
And that's what bothers me.
But that's the only thing that matters when it comes to healthcare.
That's right. So when people don't see you for what you're trying to do and base it on your color only, it does bother you.
And then money too. I mean,
yeah. And you threw out the numbers of 15 million to rehab that one, or 20 million to build.
22. I mean, I'd rather take the 22 to have a brand new modern
Not
hospital.
a lot of money. Right. It is not a lot of money.
Not when you're paying ambulance service,
yes.
all this money just to be.
Yes. I think every last one of my loved ones, whether they're on death's door or just being born, is worth $22 million.
Well, let me say, so in that same meeting in January, we presented a surprise. I think what I thought would catch everybody's attention at the meeting, that what it costs to build a $20 million hospital.
Oh, it's the document you sent me. I mean, this was laid out. I mean, I mean, it was almost in crayon, because it's that simple. This is what we need. This is how to get it. I mean, it wasn't hard. It wasn't complicated. I mean, especially when you compare it to what you're paying an ambulance service to exist.
Right.
I mean, it was just simple. So I don't understand how it wasn't taken out.
I never heard a word, no feedback, but we could build a new hospital, run the ambulance service. The difference is the hospital has to be in coordination with running the ambulance.
Exactly.
Or partner with an ambulance company that's going to work with us.
Yes.
You know? But we can do it for not a whole lot more than what they're paying right now, and it's a no-brainer.
And you can have a contract through. If you have the hospital, you control who you contract your service with.
Why we can't buy our own ambulances? Buy our own ambulances, and then we establish. We just send two firefighters, well, 3 firefighters to EMT school. So why can't we buy our own ambulances, have them at the hospital, and then send some people to the same EMT, EMS school, and then we have them there at the hospital? That's cheaper than paying these contractors to be.
Of course.
You all bring up great points, and those are what that we have been left out of that conversation, and we want to. We hope that somebody will listen to what really makes sense.
Go ahead.
Well, we have a viewer that says, is it possible to partner with Russ College to prepare to perhaps at least expand the service?
Well, now, because they had different leadership at Russ College, and I'm not quite sure what they're doing now. They had a nursing program at one time that they were discussing with us. They had a lab program that they were discussing with. I'd love to have that conversation with somebody at Russ. We'd love to work with them, but now under new leadership and different leadership, we've had very little conversation.
Right.
Okay.
I mean, we brought this to the forefront. I mean, several times, and then now it seems like it's picking up a little traction now.
A little traction, but Dr. Williams, are you willing? I know you have life, and you probably have a business or such, but are you willing to stay in the supervisor's ear, stay in their face, to push this? This is something that's needed so much. It's like food and water. It's needed.
I'm willing to do my part, but they always point at me. If it's just me, nothing's going to happen.
We've been saying if it's only Marshall County Watch that's talking about it, then it goes over everybody's head. It's just you. Right. So it's not a big deal. But then there was another situation with that is that it not registering right now, but with the hospital. But like I said, we've been trying to get people to listen. Hey, we need a hospital. Oh, this is what it was. You were talking about why are they saying we're not a real hospital now? That's what it was, that question.
Right. Is it the numbers or what?
What happened when Medicare made us, when we moved to a rural emergency hospital, that was great. But Medicare, Memphis put us in their market area, years ago. So technically we are rural, but by their data, we are not. Now, we did go ahead, and since they moved us out of that category, we reapplied, and we are considered a rural hospital now. So we can go back and do some more applications, but we can't apply for that rural emergency hospital again because they had a time limit on it. Does that make sense? So,
I understand it, but to me it doesn't. It doesn't make sense.
And we fought the CMS about that. They said, look, we had the state health director that wrote a letter, and we had plenty of people in the state that were trying to help us once we got accepted to that rural emergency hospital for CMS not to do that to us.
Right.
And they did it. And in fact, when CMS, now this is the truth, CMS is Medicare.
Yeah.
When they forced us out of being a rural emergency hospital, which was in April of 24, they didn't give us our old Medicare number back. They made us get recertified as a new hospital. What? And I mean, that makes sense.
This old hospital right here now is categorized as a new.
They made us get recertified under some new criteria. So, and we couldn't even get evaluated by the state until 2 or 3 months. So we didn't get that designation until October of that year. So from April to October, even though we took care of Medicare patients, we didn't get paid from Medicare. Now, I'm telling y'all the true story.
Yeah, I know.
We didn't get paid. We lost $1.2 million by them making that one decision. And we went back and appealed it because you acknowledged that it was your mistake. But
you got to pay for it.
We got to pay for it. So you walk to it, man. They have put the hurt on us. I mean, in more ways than one.
I mean, just like this video said, united we stand, more to marry. I mean, and that's true. I mean, we got to do that. But then this is the thing. We've had state representatives that come on. There's one on this morning. And my thing is, what can they say? What can they do? We need to get in their ear and say, look, this is what we're hurting. You said you here for Marshall County and Mississippi and all this and this district and that district. We need you now.
Right.
We need you to address this situation.
Right.
We got a doctor here, we got a hospital here, and then we're falling by the wayside. You want our vote? Hey, we need you to do something about this.
Absolutely.
Okay, one of our viewers said, indigent care, how was it expected to be successful in the county cut funds by $300,000?
Well, back in the day, back in the day, the county contributed $500,000 a year to indigent care.
Okay.
So they,
now, what is that exactly? Because I don't know what that is.
well, indigent, people that are under certain. I'll be honest with you, it's easy to calculate because anyone who's on Medicaid,
Okay.
Medicaid.
a certain point, so you can get that, that it's a federal criteria.
Right,
But
right.
you can come up with that number pretty easy.
Gotcha.
But and I don't like to use the word indigent anymore because these days that's considered to be a little.
It's derogatory.
Yeah.
Oh, okay.
People doing their best and they're considered indigent
Right.
because I think like poverty level is like 50,000, but 50,000 you can really make a living.
Right.
So
we had to submit a list to the county in order to get the reimbursement for the money. Now submitting this list wasn't always there. Now when we took over the hospital, it was down to 200,000. That's what they say it went from 5 to 200.
Yes.
But it's been 200 a year. Now, when we first took it over, they would send a check over for $16,667.66 every month without question. Then they had some leadership changes in the county, and all of a sudden, and I won't call folks' name, but all of a sudden they said, "Well, you're not paying taxes on your equipment and stuff in the building." So they started taking taxes out of the 200. So for the yearly tax, even though it's their building,
yeah.
So the
Should they be paying taxes?
so then it was reduced from 200 to 100. This is all punitive. They just trying to mess with
Now,
you.
but then but how can this? How are people doing? And this is the thing that people need to know. This is people that we're voting for that's doing this stuff.
Some viewers said have grant opportunities been fully explored?
Yes, and what we've tried to tell the county when we took over the hospital, when I took it over, it was getting ready to close.
Mm-hmm.
I didn't think that I was going to take over the hospital. I wasn't trying to own a hospital.
Right.
I did it to keep it from closing at the last minute. But in order to do that, we didn't have the diligence and time to go ahead and formulate all of these groups, nonprofit.
Right.
So I had to do it as a for-profit. You understand? And so we had to do an asset purchase, which was tough.
Right.
Which means I bought the good and the bad from the previous owner. And just to give you an idea, the previous owner owed Medicare $1 million when I took it over. That was a big hit.
So you took over.
That was a big hit upside.
Coming out
the gate, boom. And Medicare don't play. When you owe them $1 million, every time you supposed to get paid, they just subtract it. So they got their $1.1 million, but even despite all
don't they owe you money still? They take that money, but they didn't give you yours. Welcome to the U.S. government.
Even despite all of that, we took the hospital in November '99 out of the red and we put it in the black within the 2 years.
Wow.
And the record profit up until 2005. We thought we were smoking.
Right.
2005, we thought we were in gear. Didn't need no support. Now, if I don't need no support, I'm not going to ask you.
Right.
I'm the last person that, when I come to you and say we need help, I'm probably way late. I'm way late, just like this time.
Right.
I should have asked the county for help 10 years ago.
Right.
But I'm not trying to be that person.
Right.
I'm trying to work every angle I can to make something.
If I don't need it, I'm not going to ask.
I don't think they understand my DNA.
Right.
Understand they are working with someone with my DNA. I'm not looking for a handout. I'm looking for help.
Yeah, not a handout, a leg up.
Yes. I'm trying to keep this process going for the community. I could walk away anytime I get ready. That's not.
And the community's going to be worse than what they are now.
That's not what I came for. I came here to help the community, to help these people, my patients, who happen to be of mixed race, as I told you. I got all kind of races.
Right.
And we treat them all the same, whether they're rich, poor, black, white.
Yeah.
We treat them all the same.
We all need a
But
doctor.
I noticed one thing you said, and anyone with any type of insight can see. You building all of these communities. You want to bring all these hospitals and factories in here, and they got to travel 30 minutes, 45 minutes. God forbid they have an injury on the job. they're going to think twice about coming here.
You know, I didn't think about that. All these new houses and all these new plants coming in there. What are they going to go to the doctor?
Where they're going to go to the doctor, even just to get a physical. They could. Most hospitals have a little clinic that they can go and get.
And then that's going to bring more people in and make people want to come here because I mean schools, recreation, hospital, healthcare.
Yeah,
that's what they want.
Most important when you get my age.
Yeah, that's what they want.
But Dr. Williams, our time is flying by. What is the overall solution?
Well, the solution is, I mean, there's a solution, there's a plan. Is it really and truly working together and getting past biases? You know,
well, that's what it says. They'll come up with anything to stop success.
Oh, well, you know, I'm not reading your screen, but I need to read that a little bit better. Absolutely. You know, get rid of the ridiculous thinking of 1950s.
Yes.
Get rid of that.
Yes.
You know, we this is 2026, man.
Yes.
You holding back knowledge. Yes. You holding the community house. You holding Holly Springs and the area around. You just mentioned about recruiting businesses. Yeah, for businesses up North Mississippi or where they've gotten that industrial parkway, if they go to Baptist in Collierville, I understand it. But they should be recruiting some business to be right in Holly Springs. I'm right over there with an acreage that has nothing. You know, I moved over there thinking something was going to be there.
Right.
So where is the county going to come up and start doing some business for this community in this area of the county, not just the northern area?
Yeah. We reported on that. I mean, why Holly Springs is not, when you got here, it's not near that. Like I said, on Friday evening and on Saturday, it was standing there. You couldn't find a parking place.
It's being ignored.
And now,
on purpose, it's being ignored. I'm going on record. Right. It is absolutely, if you look at the data and facts, if the people in this area don't stand up and start shouting, then they are going to get left behind.
Yes.
But I mean, we got people that we vote for can say, well, no, you don't need a hospital. But what about the people? I mean, why can't we decide if we want a hospital?
Can we do a petition?
It need to be something that we decide what we want, because it shouldn't be 4 or 5 people that say you don't need it or you don't deserve it or whatever the case may be. Why we can't say if we want it? And okay, then these 4 or 5 people come back and say, well, if you want it, this is what it's going to take. Then we gotta, as a people, we gotta make a decision. Do we still want it or do we not? But we're not getting that opportunity.
Yeah, just so the public and the citizens know, when they start throwing out the numbers, 15 million, 20 million, that is nothing.
And it's over years. 30 years.
They're gonna finance it for 30 years. And I'm pretty sure they're going to get some type of tax break.
But we're saying we're paying almost the same exact money for an ambulance service
that we don't
to exist, not to come and take you for free with the money they're making.
The hospital, we the citizens own it. The ambulance service, Joe Blow, millionaire owns it.
Oh, one thing Dr. Williams said in his paperwork that he sent to me is this here. The same money, and we own a hospital. The same money, we don't get anything back because these guys can pull out and leave at any time and take their ambulance with them, and we don't have anything.
We don't have anything still.
And we're paying the same, virtually the same money for nothing. At least we'll have a hospital that we own, just like this one over here. So, I mean, that makes no sense to have somebody to exist than to have your own stuff.
So, Dr. Williams, give us your final pitch of why we need this, why we got to have this.
Well, before I give you that pitch, I'm going to say this. It's not just the board of supervisors, because I have been through multiple layers of board of supervisors.
Yeah, right.
So they got different folks. It's also the people behind the board of supervisors that don't want to work with us. The county administrator.
Okay.
The county attorney. I'm just going to say it like it is.
I mean,
you got to have, they control a lot of what the board does, right? What they tell them.
Okay.
So it's beyond, it's going to take a group effort.
Well, we need to know everybody's involved, because Marshall County Watch, we watching out for everybody.
That's right.
So if there's somebody out there that got their foot on the healthcare neck or got their foot on the brake, we need to know who that is so we can call them out.
So when we took over this hospital, in 1999. We did healthcare statistics, and Mississippi is always last, and Marshall County was at the bottom. When I did a television show with Dan Rather in 2000, I said my goal is for us to be at the top of Mississippi. And when that hospital was functioning, we got to the middle. And I was trying to get us to the next level.
It was heading up.
But the Medicare Advantage plans hurt us a whole lot. So that has stalled us. That doesn't mean we can't still get there. But this community, this area, the healthcare can get that much more better. But it's going to require the people to speak up about what they want.
What they want.
Yeah, it's not what Dr. Williams wants. It's what they want.
And that's what we've been trying to do, and that's why we've been reporting on it for months about this hospital. Like I said, being this close to it, I thought it was closed because everybody we talked to was, well, that hospital is closed, or it's about to be closed, or should be closed. I mean, we're just getting a bunch of negative after negative after negative after negative. And then that's when somebody got in contact with Marshall County and said, hey, look, you need to talk to the man in charge of that, because it's not what you're hearing. And apparently it's not.
Yeah, what we have lab, X-ray, CT, that's all going on over there. We are doing outpatient procedures. The hospital rents space in my clinic, and there's a surgical suite over there. So just yesterday, we had a vascular surgeon open up the arteries in the legs of a patient, and also he injected him for the arthritis. They have a procedure called a genicular artery embolism for arthritis pain in the knee that blocks the nerve. So there are things that are being done, but there's so much more that we could do if we were working together.
But see, there's people right now, I guarantee you, people out there now listening and watching us on Facebook and on YouTube.
They have no idea.
They have no idea that all that's going on, because I guarantee they're under the same impression we are. It either closed or it's about to close.
Yeah.
But then they're over there doing a lot of good stuff that only the people that's been there before wouldn't even know about it. So we're going to put the word out. Marshall County Watch, like I said, we're watching out for you. And then if we don't know, we will know.
Yeah.
Most of the traffic that was happening in that building was when the emergency room was open. That's why you don't know.
Right.
And that's any building. The ER is where most of the cars are going to be.
Right.
Or if you got a lot of inpatients. But because the emergency room is closed, you don't see the traffic. And that's what makes it look like it's closed, but the hospital is not closed.
Y'all got it. The hospital is not closed. We got a lot of stuff going on out there. I mean, come by and check it out.
What's the clinic?
1938 Crescent Meadow Drive.
1938 Crescent Meadow Drive, Holly Springs, Mississippi. Do yourself a favor and go get quality health care. Don't put it off just because I don't feel like driving to Oxford. I don't feel like driving to Olive Branch. You can drive right around the corner there.
We got it. I mean, Marshall County, it still has health care. I mean, I just don't understand why any elected officials will be trying to throw salt on the program.
Well, anyone, period. Because like you said, the administrators, anyone, come on. Maybe you don't even live in Marshall County. Maybe you live right on the edge of Marshall County where you can go to Oxford.
But the people are against it. I'd like for them to come on and tell us why you're doing what you're doing.
What questions do you have for Dr. Williams? What can he explain to you to make you see that this is necessary?
But the people that are against it can afford to go other places.
They've learned how to make excuses of why not to. People can always come up.
But that's an excuse.
They can come up with that all day long.
If I can't afford certain health care, I got to come here. But then the people that are against it can go somewhere else. Yeah. So how are you speaking? You're supposed to be representing me, but you saying I shouldn't go there, but I can't go where you go.
One of our viewers, we spent $12 million on a jail and spent
a lot on a courtroom. Why not a hospital? Oh, look, they just put a $500,000 floor in the old courthouse. I'd rather have a hospital than a floor in the courthouse. Yes. We don't even really use it anymore. For what? The old courthouse in the square. Why a floor of $500,000? I mean, make it make sense.
And they give us less than $10,000 a month for indigent care. That's all we get for indigent care.
But we can put a floor for $500,000 in an old.
One procedure can cost you $10,000.
Oh yeah, absolutely. Yeah, absolutely.
But they think if that was in the hospital instead of in that floor in the courthouse.
Yeah.
I mean, it just.
But they got it. that just shows me that they
That there's money for what they want to use
what they
it
want
for.
to use it for.
But there's no money for what you need it for as a citizen.
Yeah.
It's what they want to happen versus what the citizens need to happen.
Well, they need to talk about taxes too.
Oh, that's our next show is going to be about taxes because they. Oh my God, we was at the meeting, supervisor meeting Monday. Taxes is a big problem. I mean, because we got this much, we don't have this much, and I mean, it's just a bunch of confusion on they can't make a budget because what's going on in the tax office.
And maybe that's where we need to start to get it corrected so that people like Dr. Williams can get the things that the citizens need. He's not getting it for himself. He's trying to create a facility for the citizens.
But I need to talk. We need to talk to some of these representatives that want to get our votes on the 10th.
Well,
That's what they're gonna do. Because, like I said, we don't have health care. Y'all don't talk about everything that's going on. They haven't talked about this hospital and health care not once. Even today, they didn't talk about it.
Yeah. So
I mean,
we're gonna, Mr. Briggs, we're gonna have to wrap it up.
All right.
Oh, okay.
Yeah.
Need more time on
this conversation. That's true.
Yes.
That's true. We need more time on this
and
conversation.
maybe we can convince Dr. Williams to come back. The county got $6.8 million in an APRA funding and spent all of on the sewage instead of the county on the hospital. We spent $6.8 million on sewage. Come on now. Great show. Thank you for providing the best health care. Thank you, Dr. Williams.
Thank you, Dr. Williams.
I appreciate that.
But like I said, it should be. I mean, we can do a whole nother segment.
Yeah, I know.
But that's our time now. And that was a Marshall County Watch with the dude, Lynn Summer, and our special guest, Dr. Williams. And hopefully we'll pick this up again and have more about this health care.
And everyone out there, listen, we're not going to let it go. We're not going to let it
go. Like I said, we're watching out for you. Marshall County Watch is watching out for you.
Yes. Thank you all so very much.
Thank you. Where's Mr. Appropriation of Fund? Is Raymond in? Because I think we still on the